Hello, everyone. I'm Dr. Lola Ashaye, and welcome back to Connecting the Dots. This is a four-part series on perimenopause and menopause. And in part one, we talked about the phases. We talked about, what is perimenopause, what is menopause, and postmenopause. And if you haven't watched it yet, I encourage you to go back and watch it and get all the information you need. We're going to be building on that today. And we talked about hormones and what hormones actually do in the body, that they're not, especially, estrogen and progesterone. And we explained that they're not just for reproduction, but they play a very important role in other body functions like sleep, brain functions, and so much more. Okay, so today we're going to be digging into what happens when those hormones start shifting and the symptoms that can follow. So some of them are obvious, others are not. And sometimes they just sneak up on people and they can really, really affect the lives of some women, even without them realizing it. So I'm going to be talking a lot about that and hope to lay a good foundation so that there is more understanding about what's going on in the body. So before we dig in though, if you or your loved ones have been putting off your care due to healthcare frustrations, maybe you're being rushed during your visits or you're not having your questions answered, and you're seeking a more personalized approach to your health, I invite you to learn about our membership program here at InTouch Primary Care. We're dedicated to making high quality healthcare both accessible and stress-free. Also, don't forget to subscribe, share this with a friend that may be going through this transition. And, if you are in the Houston area, go ahead and book a visit with us today. All right, so let's go into it. So perimenopause. So perimenopause, like we talked about last time, is that time period before the period stop for 12 months in a row, which is menopause. And perimenopause can be as long as 2 years and or even longer, up to 10 years. So it's a long transition for some people. And it can be a hormonal roller coaster. The ovaries are still working, but they're not consistently working. So the hormone levels like estrogen and progesterone go up and down, and it's not predictable. So the body has to constantly adjust to the changes in the hormones. And because of that, some women experience a lot of symptoms even during this period. They could have irregular periods. The periods may be heavier or lighter, longer or shorter. If they have premenstrual syndrome, it could be worse. They could have mood swings, irritability, sleep problems, fatigue, brain fog, anxiety, decreased libido, vaginal dryness. Sometimes people have the night sweats and occasional hot flashes. They can have weight gain, especially around the belly area, joint pains, body aches, and may not be able to handle stress quite as well. And these symptoms can come and go. Sometimes they happen all at once. And because they don't really show up very clearly and, neatly tied up in a bow, a lot of women are misdiagnosed, some with anxiety and depression, some with autoimmune disorders, and many are sent to various specialists and undergo a lot of tests and still don't get any relief or answers. So it can be a very frustrating time for some women undergoing this transition. And this is where having a good primary care doctor comes in, because a lot of the symptoms you will usually start with your primary care doctor. And if your primary care doctor knows about menopause and perimenopause, which usually requires additional training, they can help you without you going through so much discomfort and having to do too much to find answers. So finding a primary care doctor that is knowledgeable about menopause is important. Okay, so let's say you've reached menopause, which means you've had 12 full months without a period. Your hormone levels, especially the estrogen and progesterone levels, now stay low. So they're no longer going up and down, they're just down, right? Well, this low hormone environment still brings its own set of symptoms, and many people know the hot flashes and night sweats. It can also cause vaginal dryness, painful sex, Some people have more urinary tract infections or even urinary incontinence, trouble sleeping, mood changes, low motivation, memory issues, dry skin, thinning hair, bone loss, slower metabolism. A lot of people notice an increase in their blood pressure, their cholesterol, and even insulin resistance, belly fat, palpitations, irregular heartbeat, gum disease, dry mouth, dry eyes, hearing changes, bloating, digestive issues. So, a long list of symptoms can occur during this period, and some of those symptoms can last years. Sometimes people have fatigue, anxiety, joint pains, and those can be easily dismissed as, stress or just getting older, but a lot of times they're hormone related, and a lot of women suffer silently, and some of them feel like they're losing themselves without really understanding what's going on. So, the tricky part about this transition is the impact can be slow and it can be subtle. So, a lot of people describe not feeling like themselves, but they don't really understand exactly what is going on because there's so many symptoms. Some find themselves snapping at their partners, they can't focus at work. Some feel like they're just gaining weight and they can't control it. People complain about being drenched in sweat, having to change all their clothes, so they may not even be able to sleep at all. And things like this affect relationships. It can affect people's careers, their chance to get promoted because they're not sleeping, they're groggy, they're uncomfortable. It even affects their confidence. And a lot of people, a lot of women are told that this is just part of getting older. But it's not just getting older, it could be a hormonal shift. And it's important that we understand what it is and and so that we can help support this transition in a way that is empowering. So, the interesting thing is the hormonal shift that happens during menopause is actually very similar to the drop that happens postpartum, which is after childbirth. So, during pregnancy, estrogen and progesterone are sky high, and right after delivery, they pretty much plummet. And that's why some women experience postpartum symptoms after delivery. They have the depression, anxiety, hair loss, mood swings, extreme fatigue. That's similar where the hormones were high and now they're low. And during breastfeeding, those hormones stay low as well. And so some women experience some changes during that time period as well. So in menopause, though, it's not a sudden crash like it is postpartum. They actually just continue to drop consistently lower and lower over time. Um, but just like postpartum, the body and the brain has to get adjusted. Unfortunately, during menopause, some of the symptoms can get dismissed. But there are options, and it's important for women to understand that there are options for treatment. There's hormone therapy, there's lifestyle medicine, there's supplements, there are non-hormonal medications, there are mind-body approaches, and more. The important thing is to understand that there are options for treatment, and finding a person who is knowledgeable about menopause is important because this is not information, unfortunately, that is taught in medical school. Doctors that are knowledgeable typically have to get additional training to learn about this information. But the key is you don't have to suffer. There's no award for powering through this transition. And if you do need help and you're looking for someone that will listen to you and will help you through this transition, find someone that has knowledge about this transition. So I know also that there has been fear and confusion about treatment options, especially concerning hormone therapy. And some people may have heard it causes serious health conditions like cancer and that it's dangerous. And we're going to unpack that. So listen to the next episode. We're going to talk more about treatment options. There are safe and effective evidence-based options for treatment for this transitional period. And that's what we're going to be talking about next week. So in next week, we're going to talk about the treatment options. We're going to talk about what they are, who they're for, their risks, their benefits, how the options today are different from what you may have heard in the past. So if you have learned something with this video today, and maybe you feel seen, you feel more informed, please go ahead and like it, subscribe to this channel, share with someone that might be feeling alone during this transition. And remember, you do not have to suffer silently if you are going through this transition and having some symptoms. All right, I'll see you next week. Thank you for listening.